Hello, everyone. My name is Angela, and I am going to be talking to you today about burnout and preventing nurse burnout. Three of the goals that I have decided for this presentation will be that the viewer will be able to have a better outlook on nurse burnout. They will be able to recognize when a nurse is feeling burnt out, and the viewer will be able to provide ideas and changes that could make their department burnout free. Some background regarding burnout. Occupational stress has been a problem since the 1950s. It was actually first assessed by Menzies in 1960, which proved that the four sources of burnout include patient care, decision making, responsibility, and change. I found an article written by Bonnie Jennings in 2008. This article looked at multiple different studies that have occurred over time and went deep into the root of the issues regarding burnout. They looked at the four issues that I had stated before: decision making, responsibility, change, and patient care. And then they also looked into healthcare costs, turbulence in the work environment, age, and technology. Throughout the article, they talked about how the members are not working as a team. That's usually what causes the burnout and the problems to boil over. Um, it tends to make things worse and worse and worse because you always need your team. And if you don't have a team together to take care of the patients, it's just going to make matters worse and worse. And the nurse is going to get burnt out. This nursing assistant is going to get burnt out because it's constant work and constant things happening. But if you would work as a team, things would probably work better. They also stated that the nurses that are older, or as we call them, veteran nurses, they have a tendency to stay away from the new technology with computers and all of that stuff, because when they first started being nurses, they were taught how to do everything on paper. It was paper charting all the time. And now we have this new technology with computers that it just makes their lives a little bit more difficult, causes more stress, and they're constantly asking questions, which can make stress on the newer nurses who do know how to use this technology, because they're getting pulled away from their work to have to help these older nurses out, which tends to cause burnout on all ends. That being said, I found a little chart here that talks about the signs and symptoms of burnout. Some of the signs include chronic fatigue, exhaustion and tiredness, increased risk taking, anger, self-criticism, feelings of helplessness, negativity, and irritability. And these are all just kind of signs and symptoms of what early burnout can be. That being said, with the increased risk taking, nurses have a tendency to overwork themselves, or, oh, I'll just take this pill quick and then I'll also grab someone else's pill, which is completely not okay. But because they're trying to juggle and do so many things at one time, that's when the risks start getting taken and that's when the issues start occurring. Also, with anger and self-criticism, if they aren't being told that they're doing the right thing or that they're doing very well, they have a tendency to just self-criticize themselves and think that they're not good at what they do and start to doubt themselves. Another problem with nursing burnout is that there is a shortage and there's poor staffing. Another article that I had found was written by Tara Tutton in 2012, and it was basically stating that the high complexity and acuity of patients with the less help and knowledge has been an issue that's occurring. So they did a study that implemented the standards for staffing based on evidence-based practice. So what they were doing is they looked at everything that was going on. They saw how many nurses to patients there were. The ratio at that time was 5 to 6 patients per one nurse. So during this time, they decided to implement a nurse to patient ratio, which in fact decreased the nurse's workload from 2 to 3 patients. Now they should only have 3 to 4 patients at a time. And this was all done in California, which now they've actually set it as a benchmark for the nation to be found, that we should only have 3 to 4 nurses or 3 to 4 patients per nurse, because they found it appropriate and they found that the staff was more enjoyable to be around, had a positive attitude when they had less patients to take care of. There's also with that being said, a nursing shortage that is happening, and it leads to burnout and lower amounts of patient care is being provided, and job dissatisfaction, and actually, unfortunately, poor patient care. There was a study done in 2010 where they surveyed 821 nurses and 621 patients in Pennsylvania. When they looked at this study, they just talked to the nurses and the patients. They talked to the patients about their satisfaction, and they talked to the nurses about what their work environment is like and how many patients they're taking care of and what the acuity of patients is. And when they saw how terrible it was for them, they decided to actually figure out ways to make it not so burnt out and made ways to promote a healthier environment. Then when they went back and looked at the places that decreased their burnt out, like their burnout on the floor, they found that the issues started to resolve and that there wasn't so much going on, and the patients were more satisfied with what was happening, and they felt that their care was in better hands. So looking at this now, we also have the significance to nursing. If there is burnout happening, there's going to be negative attitudes and tired nurses. They aren't going to want to be at work. They aren't going to be happy with what they're doing. There's going to be frustration happening, and they're not going to want to go above and beyond for their patients anymore because they're just tired. They're burnt out. They don't get the satisfaction that they need. There's also going to be increased turnover in the units and departments. This can be problematic. I mean, if you don't have enough nurses to even staff your floor, how are you going to provide proper patient care? They don't feel like a lot of the time nurses don't feel like they're getting paid the correct amount because they're so burnt out and they're constantly having to work overtime and they're constantly having to, work above and beyond every single day, but they're not feeling like they're getting anything out of it. And then unfortunately, it also turns into poor patient care. Nurses are unable to function to their fullest potential because they're tired and they're exhausted. There's not communication happening, which is what is causing a lot of the issues that are occurring for these patients. And there's also an increase in infection due to the lack of sterility being up to standard because they're juggling just way too many patients at one time. They're not able to just sit in one room and focus on just that patient at that time because they're having 5 or 6 other patients on top of that. There was also a study done actually regarding infections. In 2008, there was a study done by Simonetti and his coworkers, and it looked at the patient to nurse ratios regarding urinary tract infections from the placement of urinary catheters. This study, they randomly selected 7,076 nurses to be a part of the study in 161 different hospitals in Pennsylvania. And unfortunately, when they did this study, they found that 8.6 patients received a UTI from catheter placement in every 1,000 that they looked over. This is all, and they all figured this back to nurse burnout and tiredness and them having to take care of just too many things at one time. They weren't able to just sit in the room and focus on putting that catheter in a sterile field because they were being interrupted or constant things were happening. Then when they came back and reduced the burnout and were able to focus on everything that was occurring, because they cut their patients' load down to 3 to 4 from the study that they had seen done in California, they now follow the staff ratio standard. And when they went back to look at this, they found that the infection rate was reduced by at least 4,000 patients requiring or acquiring a UTI from catheter placement. So here's the big question: is how are we going to change the burnout? There has to be a positive work environment, less tired nurses, being happy in the workplace, decreasing the workload. We should follow the standard ratio for staffing. There should only be 3 to 4 patients per nurses. With a CNA assigned to only those 3 to 4 patients. It'll only help with the teamwork and making things better. And that leads me into my next thing, the teamwork. If you have a smaller team with 2 people being able to take care of that team, it's only going to make the workload and the stress decrease. If you have 3 to 4 patients to 1 nurse and 1 CNA, they're able to communicate and they're able to work together. And if you keep that nurse with just that CNA instead of having the CNA with multiple different nurses, it's only going to make things on the floor work better. The patient care is going to get better and everything is going to work properly for that unit. That being said, administration needs to get involved in this situation as well. They need to be filling these positions. They need to make sure that it is adequate. Otherwise, we're going to have burnout constantly. They need to prevent mandatory overtime for nurses that are already tired. I understand that things are going to happen and there's going to be a time where you're going to have to stay late for a shift, but it shouldn't be happening every single day. And unfortunately, I talk to people and I talk to my nursing friends and they're telling me that they're staying maybe 3 or 4 times a week, which is very upsetting. They want to be able to promote that they're there for their team. The management wants to be there, but they also need to provide the resources for their staff. Having extra people on the floor is only going to make things easier on everyone. They also need to promote get-togethers. They should be wanting to have their staff be close-knit and tight and comfortable around each other so that they do work as a team on the floor as well. They should, be maybe having a party to show their appreciation for all the hard work that everyone is putting out. The nurses just want to feel appreciated, and that would decrease the burnout, which with our little circle here, if you look at it, being recognized and having positivity would decrease the helplessness and the risk-taking and the chronic fatigue and exhaustion and the self-criticism because they would know that they are doing something positive. And they also need to be there to listen. If there is an issue that occurs, the nurse just wants to know that they're able to talk to their management. They want to feel comfortable being able to go up to them and tell them what's going on. They don't want to feel like they are told that they have an open door policy, but then when they go to talk to them, they get shunned away or told that they need to come back later. They just want to be heard if there is an issue. And then there also is the health aspect of all of this burnout to prevent it. There was an article written by Laura Ugner in 2015. This article was done regarding research studies revolving around sickness and health issues that occur with nurses that are experiencing burnout. They actually found that nurses experiencing burnout had a better chance of developing diabetes or cardiovascular disease, which is awful. We never want to see our nurses going into diabetes. And with diabetes, it's usually because they aren't getting the lunch breaks that they need to eat the healthy food that they want. They're usually having to eat on the go. And with the cardiovascular disease, all the stress building up is only going to make matters worse, and it's going to make their heart rate increase and their blood pressure increase because of the constant stress that's occurring. So after the American Nurses Association got handed this article, they realized that they needed to implement some recommendations as well, which they implemented that they request that we do not work more than 12 hours a day, which I understand. Like I said earlier, there are going to be times where you're going to have to stay later. However, then they should be able to provide sleeping areas for these nurses that are having to stay later. If they're too tired to drive home or don't feel safe driving home, they should be able to provide these places for these nurses so that they have a place to sleep and not feel like they have to drive home at that tired state. They also want to try and eliminate mandatory overtime. There should be a rotation that's happening. And a lot of the time, if you are positive and thankful and show appreciation for nurses willing to pick up extra shifts, they're going to keep picking those shifts up and there wouldn't be mandatory overtimes. But when it comes to you have to work this because you're the chosen one, it doesn't always make things easy, and it makes nurses stressed out and it causes more fatigue and negativity on the floor. And they also want to provide the nurses the ability to change their assignment when issues arise. Sometimes when assignments are being made, they don't realize a lot of the time that they've put this person on that same assignment as long as they did. And currently I work in the OR, and sometimes when you're working with the same surgeon over and over and over again, it just gets draining. I love all of my surgeons, but sometimes you just need a break. And they want the nurses to feel comfortable enough to go up and ask for an assignment change or be able to change it on their own or to talk to other nurses and be able to change their assignment without any issues occurring. So, that being said, I hope that you all um, have gotten a better understanding of what nurse burnout is and what we can do to prevent it for our fellow nurses and for our fellow staff. And I hope you all have a great day. Thank you.